Hello, my name is Jordan Wolfe. I'm with Evidence-Based Literacy Instruction, and I'm here to talk about our health literacy program. So about the EBLI Health Literacy Program. Our mission is to improve both basic and health literacy skills for pregnant women and women with young children who have medical conditions in the city of Detroit. Our vision is that all pregnant women and parents of young children in the city of Detroit will have proficient health literacy skills and are reading to their highest potential. So a little bit about EBLI. Evidence-based literacy instruction, it's a set of instructional practices and strategies that we actually train educators and tutors in to teach literacy and reading. So we're focused on teaching comprehension, higher level thinking is our core business at EBLI. And so when you think about reading, right, there's all these different components when you talk about teaching reading. Reading text, spelling, vocabulary, fluency, these are all pieces to the house. But that might be the roof and the doors, but when you talk about a house, if you don't have a foundation, you can't live in that house, right? So it's the same thing with literacy, and the biggest issue that we see in the community. They do not have the foundational skills, and that's what our system is developed around. So it's focused on phonemic awareness and phonics, and it's all focused on our own proprietary set of activities and strategies to teach those foundational skills so you can get up into vocabulary, spelling, fluency, and reading text. So that's the core EBLI system. So what are we talking about doing with the health literacy program? We're talking about taking EBLI's activities and strategies and actually combining it with health-related content to develop a health-related online learning app that's delivered over a tablet or PC. And the idea is that these modules, these learning modules on a tablet will be taken immediately before or during point of care. There'll be no more than 20 or 30 minutes in length, the learning process per time that they're taking it, per sitting. And lastly, we're going to have a strict focus to begin with just on pregnancy care, healthy birth outcomes, and decreasing infant mortality will be our initial target group. So let's talk a little bit about the business model and how we're going to make money. So initially, we're going to be selling this program to hospital systems. And our value proposition is simple. Our goal is to do many things. Among them is one, decrease the number of unnecessary ER visits. From speaking to doctors and nurses in the field, they say 80 to 90% of ER visits from pregnant women are unnecessary or not needed in the city of Detroit from their experience. Second, decrease the number of premature births. There's some statistics that say the total medical cost just for a premature birth is north of $30,000. Third, decrease the staff time spent on patient education. And lastly, improve patient engagement and satisfaction during point of care. So how's it going to break down? How are we going to charge for the product? We're actually going to charge an annual subscription. So the idea is, think about it, they're going to pay $10 a month per user. So that costs $120 per user per pregnant woman. So think about it as almost an insurance policy, right? So we're going to charge them this amount of money, and the idea is through this patient education and satisfaction, they're going to achieve cost savings and benefits in one of these categories. And then the idea is we want a minimum of 100 users per client, so that's a $12,000 price tag. And the idea is if they purchase 100 users or more, they'll also get 5 tablet devices that will be preloaded with the content. So it's really a plug-and-play opportunity for the hospital system. So let's talk about the need. So to date, in health literacy, it's a new buzzword. Means a lot of things to many people. It's been limited to 2 things. 1 is advocacy, and 2 is refining content. So the question is, okay, we can advocate all we want, and we can refine content, help them make understand, but how are we helping them learn, both from a health literacy perspective and a basic literacy perspective? So what's number 3? And that's where our program fits right in. In this process, as far as designing the program, we've talked to numerous educators, nurses, people in the field, which has driven our thinking about how do you create a realistic implementation plan, what are their challenges, and how would this actually work at the point of care. So talking to the doctors, nurses, and caretakers has been huge throughout this process. Also, we're fortunate enough that we've also been dealing with about 60 individuals who are in our target patient population with a separate initiative that we're working on in adult literacy. And so we've had the opportunity to interact with them to really understand what gets them engaged, what type of instructional methodologies do they react positively to, and how do we increase their engagement throughout the learning process. And this we will continue to do as we're designing the program, is to get consistent feedback and have a true understanding of what this target population values and how we can most effectively design content that is relevant for them. Thank you.